Good morning and welcome back to Matenaer On Air. Jane Matenaer, Greg Bach, the Calvinator on the board, coming to you live from our studio in steamy downtown Waukesha. You can always join us, 855-752-4842. Leave a comment on the live stream on Facebook, YouTube, and what used to be Twitter. And if you were looking for some new, attire for the summer, Greg Bach.
I'm always looking for fresh new drips, as they call it, Calvin. Is that what the kids say?
Drips?
I think so. I think I'm right.
It's singular drip.
Oh,
but
sorry.
That is also an outdated term. That is
Are you kidding me?
That's from when I was like 14, and I'm now gonna be 26 in October.
Oh, we're way behind.
So
man.
you guys don't get crunk either, huh? Okay, cool. Good to know.
Crunk, I don't even know. That's like before my time.
Well, yes, Jane, I could always use another t-shirt. Tell me more. How do I do that?
You can get a t-shirt. Go to civicmedia.us, and there is a button on the right-hand side on the upper right that says shop. And you can go to our shop and you can pick up Civic Media t-shirts. We have WAUK t-shirts. We have hats as well. Help spread our Civic Media pride and pick up some merch.
There you go.
If you would like. She joins us every Wednesday at this time for public service announcement. And now I feel like we have the setup for a new TV show, Hanks and Hanks, Doctors at Large. Dr. Laura Hanks is here along with her father, Dr. John Hanks. Good morning, both of you.
Good morning. Thanks for having us.
Good morning.
Absolutely. So, Dr. Laura, your father has been a general surgeon for 30 years.
Yeah, 30 years, as long as I can remember. He's been going to the OR. He used to always, and I still say this to my residents now, any day in the OR beats working.
Yeah, absolutely.
Dr. John Hanks, we'll start. Well, I want to start with you, and thank you so much for joining us and sharing your daughter with us today.
I'm delighted. Thank you so much for having us.
Absolutely. How things have changed, I would think, just considerably in the 30 years that you've been practicing. I'm curious, what is the best thing, do you think, that's happened over the past 30 years, and what do you think is the worst thing that's happened in the last 30 years?
I know what he's going to say.
Oh, I didn't realize I was going to have to answer some thinking questions here. That's a great question, because I think, there's so many people that, sort of are down on surgery and surgeons and doctors and medicine. But, I think some of the great advances in the surgical world have been the miniaturization of surgery itself that goes along with the increased optics. And where I'm going to is with laparoscopic and robotic surgery that really have allowed a whole new generation of young doctors, like my daughter, but so many others, that are now using robots, where we used open surgery with different results, frankly, and not so great results.
And when you say open surgery, it means like a really big incision versus like the smaller incisions. And it was,
there's a massive difference now. And I would think that has to make such a difference in recovery time.
Absolutely. And you said it better than I. And so that's really, for me, it was fun to sort of embrace that. Now, when I was trained, it was all open surgery. And so I had to learn what I learned about laparoscopic surgery, during my career. And it was really interesting to see how the younger people really grasped it, whereas some of us older guys would go, "Oh, no."
Do I have to download an app for this? Don't make me download that crap.
Yeah. So I'm through learning. I just want to do. But no, that's clearly, I think, one of the real major advances. But there's been so many.
How do you feel about electronic medical records, Dad?
I hate them. That's and again, that's one of those questions that my daughter comes home, and actually it was very interesting because everybody uses the Epic system, which is obviously started out there in Wisconsin in Verona by Judy Faulkner. And I happen to be, up in the administration when they embraced Epic here at the University of Virginia. And, what they what they say you're going to get and what you're going to get are not always the same thing. But the time had well come to use the electronic medical record. But the question is nobody really figured out what was the optimal way to use it. Was it a billing machine? Was it a data collection machine? Was it both? Was it a predictor of outcomes? And you would hear all these different terms saying, "Oh yeah, they can do that. Oh yeah, I can do that." And then you buy the product, and the product is geared to kind of what you bought. If you bought a billing apparatus, you got a pretty good billing apparatus. But my friends in specialty practices, there was really nothing for them in there. The ophthalmologist, for example, could barely use the clinical side of the Epic. I hope Judy Faulkner is not one of your listeners.
She's my mother.
I'm retired. They can't hurt me. But the medical record,
I'm not dead.
Yeah, the medical record, it's something that they're just going to have to refine. The time has come. It's not going away. I talk with Laura any number of ways, and my colleagues back at UVA, and they're still struggling. And they put it in, over 10 years ago, and have been optimizing it ever since. And it's a good system.
Just needs some tweaking. It needs some
But
tweaking.
it needs major tweaking.
Major tweaks. If you're just joining us, Dr. Laura Hanks is here along with her father, Dr. John Hanks, who has been a general surgeon in Virginia for 30 plus years. Dr. John, again, you've been practicing for 30 years. You must be amazed by the government now trying to insert itself into women's healthcare decisions. I'm curious about how you feel about that.
Well, and I have followed your podcast since Laura's has come on, and the OB-GYN, this just comes right down, right in their wheelhouse, right in their area. In general surgery, the general surgery that I practiced, was a fairly wide scope. I did a lot of breast cancer surgery, during my career, but the effects on women and their diagnosis that really are being dealt with by the local politics really don't affect general surgery that much or as hard as they do in gynecology and reproductive medicine. So it's not so big an issue, although when you say what the government's doing in medicine is they're doing just more than messing with reproductive health. They're doing a lot with Medicare cuts across the board. They're doing a lot with physician payments and reimbursement of hospitals. So that's the kind of the broader scope.
But I think that you've told me stories about when people couldn't get access to like safe abortions, and you were the general surgeon that then had to, like, if a uterus was perforated or something like that, like that, you've been that surgeon before that's been affected by people not having access to healthcare. So it affects everyone, but like you said, it's not like the big part of your practice, but it still affected you on some level.
That's a good point. I hate it when my daughter raises good points. Look like an old man, which I am. Well, that's a good point, because in rural surgery, if you're thinking about the rural surgeon, which is a vanishing breed now,
right?
A rural surgeon in the old days was actually would do in their practice orthopedics, simple orthopedics, and might do deliveries. We were just talking the other day about family practice and general surgeons. But if you look at rural surgeons' surgical records these days, or people that are going abroad and helping resource poor countries, they're doing some C-sections and they're doing GYN procedures. But if your question focused on sort of the political climate right now, that volume's not that large in general surgery, but it's still important to consider that when you're thinking about, okay, well, another part of this is how we deliver general surgery and medicine, out in rural counties. And Wisconsin and Virginia are very similar in the amount of rural population that we have and that we serve.
Yeah, and this is an ongoing problem. And Dr. Laura, we've talked about this before, and in states that are severely restricting reproductive health care. I mean, OB-GYNs are fleeing these states, which is going to have larger ramifications that it's going to take a number of years to play out, actually.
Absolutely.
And since we're talking about reproductive health care, the mifepristone case came down last week, Dr. Hanks.
Yeah.
This is a good thing, but this could still go away.
Right. So let's just do like a recap. So there's mifepristone, which is an anti-progesterone medication. So basically what it does for patients that are having a miscarriage, or if they would like to have a termination, it works against progesterone. Progesterone is the hormone pro-gestation. It supports a pregnancy. So this is going to unsupport a pregnancy, for, to put it in layman's terms. And we know that it's safe. We've known that for years. This case, while you want to get excited because SCOTUS said like, oh, we're not going to like take it off the market, we're basically status quo. Like, it didn't change anything really. It just said, like, it's still there, but there's still so many states that say you can't have abortion, so you can't have access to this pill. But again, we use it for miscarriages, and we have very good data to show that it helps a miscarriage pass. And so that's, again, in danger if this were to go to a point where, again, the Biden administration has said that if Trump comes back, he could appoint someone that'll take this medication away, this very safe medication that has lots of data for it, could take that away, not only from, again, patients that want terminations, but patients that are having a miscarriage. And it's just frustrating, Jane.
I agree with you, Dr. Hanks. And again, with this whole outline in Project 2025, from what I understand, the Trump administration could ban all kinds of things without ever having to go through Congress, because Project 2025 essentially gives all the power to the office of the presidency. So he could go to the FDA and say, I want you to declare these drugs as unsafe, and then just pull them off the market.
And it's just so fascinating because Trump still can't really figure out his opinions on contraception and abortion. Like he gets so fumbled, and he just like doesn't, I mean, he's, not a good speaker at baseline, but it is really like fascinating every time it gets brought up. He's just like, yeah, we're doing great things. We're doing great things. And we're going to do great things. Like, what does that mean?
Yeah. and everybody's really happy about this, and it's working out beautifully. There is a case in Texas right now. Ryan Hamilton has been very open about the miscarriage that his wife suffered, almost died, almost bled out on their bathroom floor. There are horrifying examples coming in from all over the country, and this isn't a topic that's going to be going away. All right, we have to take a quick break. When we come back, we're going to talk about the hot heat and how to stay alive in the heat. It's Hanks and Hanks, our new TV show. Dr. Hanks and Dr. Hanks.
This Friday on ABC.
We'll be right back with us. Stay close. You're listening to Matenaer On Air. This is the Civic Media Radio Network. Good morning. Welcome back to Matenaer On Air. Jane Matenaer, Greg Bach, Sweet Kelpie, coming to you live from our studio in downtown Waukesha, where you can always join us. You can call, you can text at 855-752-4842. Leave a comment on the live stream if you're watching on Facebook, YouTube, or what used to be Twitter. She joins us every Wednesday at this time for public service announcement with a special guest today. Dr. Laura Hanks is here with her father, Dr. John Hanks, and we're proposing a new TV show, Hanks and Hanks. And Andrew, one of our friends on the live stream, says, Hanks and Hanks, Civic Media TV. It could be next. You'll be our first show, you guys. You'll be the first show we put on Civic Media
We'll
TV.
make you stars. Yeah.
Thanks for watching the Hanks.
Right. Let's talk about the extreme heat and what it does for the body and why people need to be so careful.
You guys must have known that, like, got the old man on. All he loves to talk about weather. This is like so in his wheelhouse.
But it's been dangerously hot here in Wisconsin and certainly across a large portion of the country. So,
Right.
what does extreme heat do to a human body?
Right. Well, I grew up in Virginia. Dad grew up in DC, and we were just kind of talking on the break about how, in August here, just growing up, you just don't go outside. You have your, air conditioning, and everyone just stays inside because it's so hot. And I was telling him about when I lived in Olympia, Washington, there was a heat wave like this. I don't know if you remember it in 2021, where it was like 3 to 5 days of 100-degree heat. And in the Pacific Northwest, a lot of people don't have air conditioning.
Oh man.
So my patients that had delivered babies, I was having them stay. I either had them stay in the hospital an extra day or go to a hotel room. Yeah, I was like asking, because I never did this on route. I'm like, do you have an air conditioning? And they're like, why? I've been in a hospital. What are you talking about? I was like, well, I just don't think you can take a newborn home in 100-degree heat. Like that's not, if you don't have an AC. So, but to your question, the important thing, as with everything, is hydration. So everyone should be carrying around their water bottles with them and making sure that you have extra water in your car if you're going somewhere and your car were to like stall out or something, so that you're able to hydrate, because that's kind of going to be the biggest thing, is not hydrating because you're sweating off water and whatnot. Staying cool, staying inside. Sunscreen is really important. Always, if you have access to a pool and can cool off there. So those are all really important things. What else, Dad?
Well, you have me around because you're interested in the history of surgery. And if you look back around the World War II, a lot of the studies about postoperative need for hydration were done in southern states like Louisiana, and was a big one. New Orleans was the big hospital, and Texas. And these were all done in hospitals with no air conditioning. And they were calculating what the water needs were after surgery. And then they had to completely recalculate all of those after the air conditioning came in,
Sure.
because there was so much hydration that was lost. It was practically half of the needs for the hydration. And that's just a thumbnail sketch of it. There's obviously a lot of other parts to it. But the hydration with the humidity is very profound, particularly in the older. So I think the idea of, being as comfortable as possible and taking advantage of shelters that have air conditioning is extremely important. Not just for people that have had medical issues, but just the frail as they age. It's extremely.
And I think it's important too to just remind folks, because we are in Wisconsin. I know there's water in beer that doesn't actually count
Oh man.
as hydration. I just think it's important to mention these. Coffee also involves water. That also is not going to replace water.
Yeah.
I'm with you, Greg.
Yeah, I was gonna say, Dr. Miller and Dr. Bush said that I could drink as much water as I want. It could be a beer if it's okay.
No, yes, you can have a beer, but you want to supplement that with a bunch of water, right?
Yeah.
Yep.
Yeah. Not having a beer just makes the suffering worse.
He's retired.
I'm retired.
No. These are doctors' orders. These are doctors' opinions. I respect doctors. I believe in doctors. I'm going to write this down. Drink more, doctors.
Yeah.
We have just a couple of minutes left. Real quickly, Dr. Laura, you shared this with me in a text. Dr. John, you survived a plane crash in 1984, and your brother was on the flight that crashed into the Hudson. Maybe you guys should stay away from planes.
We're lucky on planes. We survive.
That's true.
I was going to say, you're looking at it half empty right now, Jay. I'm looking at it half full.
Yeah, it turns out there must be some genetic predisposition to. We haven't really studied that yet, but my brother gets a little more play because his hands were actually in the Sully movie. As he's trying to open the door in the back, and the door jams, flooding the back of the plane. That was my brother. trying to get
That's
out the
remarkable.
That's an amazing resume. Hello, I'm Dr. John Hanks. I am a practicer of general surgery, and planes cannot kill me.
We'll work that into your TV show,
Exactly.
Hanks and Hanks. We'll get that in development. Thank you both so very, very much for joining us. Dr. Laura Hanks will be back here next Wednesday for public service announcement. Dr. John Hanks, you're welcome to join us anytime you want from Virginia.
Oh, well, thank you. I follow your podcast along. It's very well done. I also want to compliment Calvin because I think he's the guy that really makes everything
Absolutely.
flow. So, Calvin, this is
Absolutely.
my chance to thank you because I know that you do all the work.
Absolutely. And send all your complaints to Calvin at calvindoesn'tcare.com. All right, Dr. Hanks, public service announcement. Thank you so very, very much. Thank you, Greg and Calvin, and our engineers. Without you, nothing works.